Your Eye on Health tonight, we are recognizing Heart Health Month. Honestly, I think we should just do it all year because it's a good thing to do. Baylor Scott White, our friends are here. We're highlighting the critical role the aorta plays in your heart health and the problems that can go unnoticed. I don't know much about it, but he does. That's Dr. Mazin Foteh. Thank you for being here, by the way, today.
Thank you. Thank you for having me.
Appreciate it. Vascular surgeon, by the way, with Baylor Scott White, joining us to understand warning signs, which is one thing we can all agree we want to know. Let's start with Aorta 101 first.
Sure.
What is it? Where does it exist? And why do I care about it?
Yeah. So your aorta is the big blood vessel that comes off of the heart, travels through the chest, and then down into your abdomen. Okay. Off of that structure, all of the important vasculature that feeds your body is essentially coming from that one organ. That blood vessel does have a tendency over time in certain individuals to become diseased. And by becoming diseased, oftentimes it can expand and maybe even turn into an aneurysm.
Does it become diseased because of anything I'm doing?
It can, absolutely. So things like not controlling your blood pressure, not controlling cholesterol, or even smoking, which is one of the biggest risk factors, can lead to an unhealthy aorta.
Aortic aneurysms. I think we all have heard the term aneurysm. Some people may know what it is. Some people may, oh, it doesn't sound good. You know, it's never good when we hear that. When we talk about those, tell us more about the concern with the aneurysm, because that is, and this is layman, that's something that happens super fast, right?
Well,
not necessarily.
Not necessarily.
Tell me more.
So the aorta can degenerate over a long period of time, and in doing so, it starts to expand and sort of become a balloon. As the wall weakens, and with the pulsations of every blood flow, every pulse of the heart, the aorta will tend to expand over time. That is what develops into an aneurysm. Okay. If the aneurysm itself gets to a very large size, it's at risk for rupture. Right. And ruptures can oftentimes mean mortality.
So for understanding, the aneurysm itself is the thing that formed, the balloon that formed.
Yes, sir.
The rupture is the event of the aneurysm.
That's exactly right.
Okay, because I think a lot of people equate, aneurysm is the rupture. But
sure.
Technically, in your world, that's two different things.
That's right. That's right. Okay. A lot of aneurysms actually can stay relatively small for a long period of time. Okay. Some of them don't need to be treated. But when we identify them, we surveil them over time. And as they grow and as they get to a critical size, that's generally when, as a vascular surgeon or a cardiothoracic surgeon, you want to treat it to prevent that rupture. Okay. That's the reason why we typically go in and fix those.
Okay. Learned a whole lot, rather, honestly. What can we do, if anything, to look inside to see if we have this kind of silent condition? Because you say you can be a human being who has an aneurysm in there. You know it's in there. How do you know? What can we do?
Yeah, so in the U.S., there are certain studies that we can order to identify an aneurysm as a part of screening programs. If you're a male over the age of 65, when you enter Medicare, Medicaid as your health insurance provider, they will pay for a screening study looking at your aorta to see if you have an aneurysm. You also have to be a historical smoker. Okay. What we don't have is we don't have that same sort of latitude with our women patients. So women entering Medicare and Medicaid at the age of 65 don't have the same luxury of ordering that study. Why? Well, you know, there's a lot of policy reasons why, but cost-benefit analysis certainly comes into play. But what I wanted to stress to you is that there are many women patients who have aneurysms, and we cannot ignore that. Because when they present, they tend to present at a much larger size. They tend to present with more advanced disease, and oftentimes, even if we treat them, the outcomes are not the same. Okay. And it's really due to a lack of being able to treat at an early phase.
Right. Yeah. So that's aortic aneurysms. There's something called aortic dissection. What is that, and why do I need to know about that?
So aortic dissection to you should equal emergency, okay? What's happening there is, think about your aorta like an onion. And one of the layers of that onion gets pulled away from the other layers. That creates a weakening, and that weakening leads to a tear. That tear can extend from the ascending aorta, just beyond the heart, all the way down through the abdominal aorta. As it tears rapidly, the aorta could rapidly expand. So for ascending dissections, type A's, those patients need to be transferred to a hospital emergently and one of my cardiothoracic partners are the ones who would address that and operate on them.
Yeah.
Dissections that happen just beyond the heart typically early on can be managed medically, but oftentimes over time those patients will require therapies to treat the dissection.
Right. I feel like we got this great little brief free medical class, right? Not that any of us are going to pass, right? Dr. Mazin Foteh, thank you so much.
Thank you.